Hello everybody, and I know we've been anticipating this. It's time to start your clinicals as an advanced EMT, and I just want to take time to go over the paperwork. Now, this first form that you see here in front of you on the screen, this is a form that you're going to fill out for every day you go to your clinical. Now, you're required to do 24 hours, so it's important that you fill this out completely. If it is not filled out completely, then that clinical will not count until it is filled out completely, or you will have to go back and redo it. So to start with, it's self-explanatory pretty much. You put your name at the top, and then you put the date. Now, the date is extremely important because I need to be able to prove that you were there on that day. So you need to fill the date out and make sure you have your name. Now, at the bottom of the form is extremely important as well. You need to have your preceptor's name, and you need to print it on this line. So it needs to be printed so that I can read it. If your preceptor has horrible handwriting, well, then you need to do it. And if you have horrible handwriting, then I suggest you take your time and you write it neatly, because if I cannot read their name, it will not count until it is fixed. The next thing is the preceptor's signature, which goes underneath it. Of course, it's just their standard signature, and then they need to date it, or the date needs to go there. Next is the time you got there, and then the time you left. So that needs to be filled in completely. Alright, so the next parts of this form that I want to go over are the skills that you have to do. Alright, so we'll start here at total patient assessments. That's 15. Now you have to have 15 full assessments. That's not 15 or that's not a call where, hey, a patient came into the station for a blood pressure check and I checked their blood pressure and their blood pressure was fine and they left. That is not a patient assessment. A patient assessment goes like arrived on the scene of a 50-year-old male complaining of chest pain, or it could be something like a 50-year-old male arrived at the station requesting a blood pressure check. Upon his arrival, we assessed his airway, breathing, and circulation. Patient was talking in complete sentences. Patient had no issues with airway. Patient's breathing was regular and non-labored. Patient's skin was warm and dry to the touch. Patient had good pulse, motor, and sensory function in all four extremities and was ambulating well. Patient's pupils were pearl. Patient's vital signs are noted below. You can note those. And so on. So you can make it a patient assessment, and you should. You should sit down and take the time and do all these patient assessments. Now, with those patient assessments, you need a total of 15, but you also need 5 pediatric patients. And you also need 5 adult patients and 5 geriatric patients. And geriatric patient is someone who is over 65 years old. So we need to note that, and you need to write that down and know that a geriatric patient is over 65 years old. And I'll go back and I'll make a change here so that it's in there so that you remember, but they need to be over 65. You also need to administer 10 medications. That could be 10, to 10 patients. So that means or sometimes you administer more than one medication to a patient. So you might have where you give baby aspirin and nitroglycerin to a patient. Well, that's 2 administrations there. So you could do that. Sometimes you may give 2 doses of dextrose or D50. So you may give a half amp of D50 to a patient and then reevaluate. And you need to make sure you document this in your paperwork. It could be like, hey, after you do your assessment and your treatment section is established an IV normal saline and administered, 12.5 grams of D50 to patient. Then 5 minutes later, reassess patient, readjust their blood glucose. Blood glucose was 100, and then you could put administered an additional 12.5 grams of D50, and that would count as 2 there. So you need to make sure you get 10 admins of medication other than oxygen, not counting oxygen, okay? So you also need to get 10 IV lines. So you need to successfully establish 10 intravenous lines as well. You also have to ventilate an unintubated patient once. So you got to do that. You also have to assess and treat a patient with chest pain. That's one. Now, if you have a patient with chest pain, and let's say it's contraindicated to give aspirin or nitro, you still treated them because you transported them, you probably started an IV, gave them oxygen. That's still treatment. So that's one. Also, same thing, assessment and treatment of a patient with dyspnea. That's one. So this is another one where you can give oxygen, you start an IV, and if you give them an albuterol treatment and then give them a Atrovent treatment, that's 2 administrations of medications there, okay? You also have to assess and treat a patient with an altered mental status. Now, what is an altered mental status? All right, so you got to do that as well. Now, the thing is, it has to be a specific altered mental status. And let me see if I should have that up. And I'll go back and I will put that in. Put this in because this is the form that the state uses. So it needs to be an altered mental status. It needs to be a stroke, seizures. It says etc. So I don't, so we need to try to see, if we've got like a stroke or seizure patient there. It's in parentheses, but any patient with altered mental status, you can make sure you document that there, okay? You also have to do a team leadership. All right? Team leadership means that's where you were in charge. So you need to work your way up to that. Tell your preceptor ahead of time, hey, I need to take the lead on one. So if you come up and it's a diabetic patient, well then, go in there and be the team leader and just make sure you talk to the preceptor and let them know what you need to do. Now, the preceptor may not allow you to be that team leader on the very first day, on your very first rotation, but they will work you up to it. And right here is where you're going to put that. Acted as a team leader on a medical trauma call. Now, you have these other things down here. You need to do these as well. Uses of a wheeled stretcher. I'm sure you'll have no problem with that. Transfer a patient between stretcher and a bed. That's like from your stretcher to the hospital stretcher. You shouldn't have a problem with that. You shouldn't have a problem using the oxygen tank. Now this here, correct operation of an oxygen tank and regulator, you don't have to really have a patient there. Just whenever you come in, just say, hey, can you watch me put this tank together, and put the tank together before you run a call or something, okay? So use of a non-rebreather mask or nasal cannula, I'm pretty sure you will do that amongst the course of your treatments there. A scene size up, 5 of them, you're going to do that on every call you go on, so you should have 15 of those in reality. Assessment of mental status, you should have 15 of those. Assessment of airway, you should have 15. Assessment of external bleeding, you do this on every patient. Now, perform a radio transmission, you're going to have to talk to your preceptor because it's something you may have to work yourself up to. Perform a patient report at the receiving facility. This is something you may let your preceptor give the first report there, but then maybe if it's a non-critical patient and there's time, then you can give a report to the nurse as well. Okay? And then right here's a big one. You need to complete 15 pre-hospital care reports as instructed. I've got to have 15 PCRs there, okay? And the PCRs look like this. These are the PCRs. It's important that you have the date here and on this form as well. If it is not filled out 100%, I will not accept it. It needs to be filled out 100%. If it's not, then it does not count. So you have the date that you ran the call, the patient's age, and the patient's sex. and the call in the county the call originated in. So the county where you're at, okay? So there's very little demographic information here, and that's to protect the patient's privacy. So because I'll be reading these, and I actually have no right to their medical information, so this protects the patient and protects me and you, okay? So do not put like their date of birth, don't put their name, don't put anything. Just this basic information. And the narrative, you're going to write your narrative like you would any medical call. Now, if you claim it on the other form, on your daily form, it needs to be documented in your narrative. Then down here, you've got your vitals, your blood pressure, pulse, respirations, and AFPU. If you put a vital sign in here, you need to have a time there. If there's not a time, like I said, I will not accept it. I need the times filled out. Everything needs to be filled out. Now, that doesn't mean that you have to get all these vital signs, but you need to, for the times that you do get vitals, you need to put the times. Now, you need to print your name here, sign your name below, print your preceptor's name, and once again, if I cannot read what it says, then I will not accept it. Then you need to print your preceptor, and then have your preceptor sign it. Now, also the thing is, and I'm going to talk to you about handwriting. If in the narrative, if I cannot read it, then it is no good. I will throw it out, and you will have to redo it. If you have to type the narrative, well, then let me know, and I'll set it up so that you can type the narrative out. But if you're writing this narrative, I need to be able to read it. And once again, I'm going to emphasize that I must be able to read it. If I cannot read it, it will not count. Trust me, I will not take it. Because I have to be able to go into this narrative and read it and prove that you did these skills so that you get credit for it and that you can graduate. And if I can't do that, well then it's not going to happen, because I'm not going to just fake it or anything. So you make sure you use good handwriting here. If you have any questions regarding filling out these forms, please let me know. Please get with me, okay? It's very important that we do this right the first time. Remember, the PCR, you do one for each patient and every patient. This form gets filled out on every day. Also on this form, let me show you here. If you see here, we have, let's see. You have here like the number 1, number 2. Now this is patient number 1. So whenever you go out on your first patient here where it says total patient assessments, the computer is giving me problems. Alright, so see where it says total patient assessments? Here, you're going to, like for patient number 1, you'll put a 1 here. And if it's a pediatric patient, you'll put a 1 there. If you administer medications, and let's say you gave just an Atrovent treatment, then you'll get a 1 there. If they were, anything else, if you were the team leader, you'll put a 1 there. Okay? And so on. So any questions on that, please let me know. So just make sure you tally these up. Like I said, you can, especially in the things where you do multiple stuff, I need to know. Like administration of medications, you may end up giving 2 different medications on one patient, so you'll put a 2 there so that I can keep up with it and it can be kept up with, because this is what gets turned into the state. Okay, so if you have any questions or comments or anything, please let me know. Please reference this as much as you need to, and good luck, and I hope you have fun while you're out on clinical.